So this is an exercise that strengthens the stabilising muscles of the hips. It's a version in lying down. There's also a video for a version in standing up. So go with which works best. It is good to kind of get into the lying down version because it will add an extra quality to what the standing up version gives. So doing a bit of both is ideal, but do one at least. Okay, so lying down on your side, you can rest your head on your bicep on the top of your arm. Maybe you want to kind of lift up onto your forearm if that's more comfortable, although that can be a little bit aggravating in the back. So I always go for the kind of lying on your arm, or you can lie on a pillow if that's more comfortable. So the bottom leg is bent, the top leg will be straight. And the way the hips are, you feel this bony bit on the side of the hip. You want to be able to almost as if you had that lined up right on top of the bony bit of the underside hip. So i.e. your hips aren't falling forwards, they're not falling back, they're in the middle. You may want to use your hand here to support, to stop you kind of rolling forwards. Rolling forward is better than rolling back, so you can use your hand to stop you. Okay, you look down, you can see your toes, or your toes are in kind of your line of sight. And then we're literally raising up the leg and raising it back down. So what we're looking for, we're leading with the heel. So it's as if the heel lifts first, the toes they're almost slightly pointing down. You're bringing your toes towards your shin a little. And when you lift up, there'll be a point where you think, oh, I don't really go much further. If I did, I'd start to lean forwards or back, and you'd lose this alignment around the pelvis. And so we're just lifting up till we get to that point where you feel the pelvis might wobble either way, and then we're lowering down. And we're doing it quite slowly. So when we first start doing this exercise, you'll probably find that the movements are a little bit jagged, particularly on the way back down. And that's great. That just shows that yes, there's work to be done here, and we can strengthen up that muscle. As the movement gets smoother and less kind of stilted, less jagged, then we know we're getting some strength happening there. And so we're going to do 10 of these on each side. So feel free to leave the video here and do your own 10, or we can do them together. Okay, it's quite nice if you breathe in as your leg lifts and you breathe out as the leg lowers. But if that's kind of one step too far, do not worry. Just ignore the breath, just breathe. That's great. Okay, so let's lift the first one, lifting up, lower down. Breathing in to lift, out to lower. So on number 3, and down. Already I can feel this biting, and we're only on 4, 5, 6, 7. Just check you're still bringing your toes towards you. Check you're still leading with that heel. Let's do 2 more. 1, 2. And then bring the knee forwards. It just helps to relieve, stretch out around this area that we've been working. We can even massage into that area a little bit if you like. Okay, and then let's move over to the other side. So same thing again. Lying on our side, bottom knee is bent, top knee is straight. Bring your toes towards you. We're leading with the heel. The hips are stacked. We can use hand for support. And let's breathe in to 1, out. 2, down. 3, down. 4, 5, 6, 7, nearly there. 8, 9, 10, and back down. Well done. Then bring that knee forwards, give a little stretch. Okay. So if you found that you've been doing that and it's not really aching that much, then we can do a few more repetitions. So we're kind of going up to 20. You can equally, when you get to the top of the movement, start to do some little circles here. That will just really get into those muscles. And we go forwards, we can go back. And what we're aiming for is it to feel really quite achy. If you do it on one side, just flip over and do it on the other side as well. Okay, enjoy.